begin my questions for you today. I'd like you to give a little bit of background information, introduce yourselves to the jury. How long have you lived in Chicago?
All my life.
And are you married?
Yes, I am.
And how many children do you have?
I have two.
2 children.
Mm-hmm.
And where did you initially earn your bachelor's degree at?
I got my bachelor's degree at the University of Wisconsin in Madison.
And where did you do your further education at?
Yes, I went to the University of Chicago's medical school in 1976. I graduated, and then I went to Northwestern University Medical School for my internship, and back to the University of Chicago for my residency.
For your residency. And did you do any other educational work past your residency at Northwestern?
I'm a diploma in pathology for clinical and forensic pathology.
Just so the jurors understand completely, what is clinical pathology?
That is just the study of disease in the body, pathology in the body, and how the body responds.
And what is criminal pathology?
Forensic pathology is when we apply that into the legal system to explain it in courtrooms, etc. Okay,
thank you very much. And do you testify usually in court cases, Dr. Angrist?
Yes, I've testified in quite a few. In fact, this year already, I've already been in 6 court cases.
And considering your credentials, your massive training and specialization, I assume your skills require a fair compensation. What do you charge normally for your cases?
I have a flat fee of $500 an hour.
And it is not affected by the outcome of the case or the testimony that you're asked to give?
No, sir. Either way, it's just $500 an hour.
Whether they want you to come and ask. Okay. Well, thank you very much. I'd like to move a little bit more to the defendant in question, Robert Ramirez. How long have you known him?
About 14 months ago, I met him.
Okay. And could you describe a little bit about that encounter?
He was admitted to the Cook County Hospital emergency room with a gunshot wound in January of 1996. And
excuse me, doctor. You were actually there when he was first admitted, were you?
No, no. I was in 1998. I was asked to review his case and to examine him.
Could you explain that examination a little bit?
Well, I examined the gunshot wound that he had, the scars from his gunshot wound that were received.
Mm-hmm. And also, what medical documents did you review in preparation for this case?
I had his entire chart from his admission to the Cook County Hospital.
All right. Let's focus a little bit now on that fateful night that he was admitted to the hospital. Could you explain to us what happened after he was allegedly shot in the shoulder?
He was admitted to the emergency room in a state of hypovolemic shock.
Meaning?
He was in shock because of the extensive bleeding from the gunshot wound.
In the first part of his admittance, how much blood was drawn from him?
After the chest tube was inserted into the right side of the thorax, there were 2 liters withdrawn in the first half hour.
All right, 2 liters, so like a 2-liter bottle of pop.
Exactly.
Of that much blood was within a half-hour time period, correct?
Correct.
So, he says he was shot in his right shoulder, and what occurred after the bullet entered into his shoulder?
The bullet went through the skin, it hit the edge of the scapula, which somewhat deflected it, and then it went through the right lung and to the sternum. It actually hit the xiphoid process, which is the process at the end of the sternum, and shattered it, and then deflected over and entered the right ventricle of his heart anteriorly, actually from the front.
So, the bullet entered the back, hit his scapula, shoulder blade, deflected down, went through the lung, and then hit his xynex?
Xiphoid process.
xiphoid processor, and then deflected into the front part of his heart?
Right.
Okay. Thank you. So, he was admitted into the hospital and had a loss of blood from the wound, and the bullet entered into his heart. What happened to him after he was admitted to the emergency room?
He was sent to the intensive care unit. Chest tube was inserted. Blood was drained. That lung was eventually reinflated. He was given large amounts of blood and colloidal suspensions to bring his blood volume back up.
Okay.
And after 2 weeks, he was moved out of the emergency or the intensive care unit. And it took 1 month later. He was stable enough to remove the bullet, which needed to be removed because of chance of infection.
All right. Now, switching gears a little bit right now, Doctor. The defense contends that Robert Ramirez was actually standing up when he was shot. And if that was the case, how would you expect the bullet hole to look?
If he was standing up, I think the bullet hole would actually, then the bullet path would have been going upward through his body, not downward through his body. And the margins of the actual insertion side of the bullet are very jagged. Now, at a 3-foot range, being shot at 3 feet, you'd expect a perfectly circular hole, right? But this one was very jagged, which indicated that he was moving at the time the bullet entered his body.
Because, in fact, Robert Ramirez testified that he was knocked down by Officer Levy and that he was getting up off the ground when he was shot. So, being in a prone position like that, getting up, the path of the bullet and the condition of the bullet hole would support the idea that he was, in fact, getting up when he was shot?
It's very consistent with that testimony, yes.
Okay, thank you. Robert Ramirez, could you describe a little bit his post after he was released from the hospital? And I realize you only were able to look at him shortly. What is his current condition now as far as for future employment work?
Well, currently he lost a lot of weight. He lost 27% of his weight while he was in the hospital. And
From 183 to 136, was it?
Yes, exactly. The injuries he sustained were massive, involving his heart, his lungs, shattered bones, surgery, horrendous blood loss. So his road to recovery is a long one. It will take years for him to actually totally recover from the assault that was placed upon his body.
Okay. One final consideration, Doctor,